Good morning, everybody. I know it's been a long time since I've posted anything. It's the day after Easter. I am so excited to just be alive. I woke up this morning with so much energy. I just want to get up early and get out and just get out of the house and make a little short video for y'all, give you a kind of an update. It's been probably over a year since I posted anything, and I've been busy just trying to clean up my diet, using more natural-based products, staying away from the chemicals, trying to keep my chemical load down to see if it'll reset my body so that my body can start healing itself. During the fall of last year, I pretty much went through the whole year, no flare-ups, doing pretty good, having my days, but most days good. And I had a flare-up like in the fall, so my doctor told me about this treatment called Soliris that you get in the IV, and it's been used in other rare conditions. I'm not sure exactly which ones, but it's kind of similar to Ivig, being that it's like an antibody. It works directly at the neuromuscular junction and supposedly heals some of the receptor sites and makes it easier for the transmitters to bind to the site so that you can have more muscle activity. And supposedly a lot of people have gone into remission after using it. So this was like back in maybe October or November. I started the treatment in January. And at the beginning of the treatment, you do a 5-week induction phase, which means you get a treatment every week, one day every week for 5 weeks. And then in 2 weeks after that, you start every 2 weeks after 5-week induction. It will be your maintenance dose. So I started off getting 900 milligrams every day for 5 weeks. The first dose, I felt a little difference a couple of days after. It lasted maybe 2 or 3 days, a little bit more energy. I was able to get my breath count up higher than normally. I went from like maybe 26 to like 30, a few numbers higher, which was good. For those who doesn't know what the breath count is you just take a deep breath and you count out seconds. You just count until you can't count anymore and you can't hold your breath anymore, and that's your number. It kind of determines how your respiratory muscles are working. Kind of helps you see, okay, if you're having a really bad day, you can do it and you can see where your numbers are, versus okay, if I'm having more energy, and you'll see your numbers higher on those days. So anyway, it took a couple of weeks before I really noticed a change, and then I would notice like it would last like maybe 3 to 5 days, the energy level, and then I kind of would fall back. So once I got out of the induction phase, which is the first 5 weeks, I started the maintenance dose, which went from 900 to 1200 milligrams. That's when I noticed a huge difference. I mean, like, I haven't felt like that in years. I was able to do so many more reps on my push-ups, on my little 3-pound dumbbell weights. That's all I've gotten to. I just noticed more stamina. Now, with the 1200 milligrams, it seems that I went from like maybe 3 to 5 days noticing difference to like maybe a week and a half. And so even with this that I'm getting, I'm still on the Ivig because my doctor didn't want to take me off that because I had been so, on the edge and just kind of in and out of the hospital. So she said, we're going to keep you on both of them. Now, I did have a little reaction when I first started in January because it's just kind of new. It's not something that a lot of people are doing for MG. And I ended up getting the Ivig and the Soliris on the same week, and I had a reaction with my blood pressure and just all kind of icky stuff. So now we got that straight. Now I'm just only doing it like I'm on the every other week maintenance dose now. So it just happens to fall where every other week I do the Soliris, and then one of the 2 weeks that I don't do the Soliris is the Ivig. So as long as I have about 3 to 5 days in between, I guess my body absorbs the medication, and it's kind of not, the concentrations are not as high, so when they come together they don't clash and my body's not screaming like, what is going on, you know? I mean, it was literally crazy. I had to go to the hospital at 2 o'clock in the morning because the reaction was so bad. I had heart palpitations and shortness of breath, extreme shortness of breath while I was trying to sleep. So ambulance ride. But I'm doing well. Now I'm just I'm still trying to eat better, and hopefully I can eventually get off these steroids. That's my goal, to eventually get off these steroids and just go from there. I'm living my life, living my best life, I have to say, and I just want to put this treatment out there, let people know there is hope. It may or may not work for you. Like I said, it doesn't keep me through the whole month, because like that week right before my Ivig is, my body is just kind of like, okay, I'm ready for Ivig. You know, I can feel it. So, but it's worth a try. If it's something that, you know, if you're not getting the relief that you need, or it's something else that you're looking for to try, hey, it's working. I'm moving around more than I used to. Although I'm still having symptoms, I'm living the best I've lived in a while, and I'm so thankful to God. I'm so thankful to be here. I'm so thankful to be alive. I'm just glad to be able to have this outlet, to be able to help other people, put my story out there. So just want to show my face because it's been so long. Everybody have a wonderful day, and I will be back on here again, hopefully not as long as I did this time, to give y'all an update and let y'all know how I'm doing. Have a great day. Bye.